you, Mr. Gonzalez. I'm going to do your trach care now, okay?
Tracheostomy care is performed at least every 8 to 12 hours, and more often as needed to remove airway secretions and drainage from the tracheostomy stoma. The tube itself may cause irritation at the insertion site. This poses the risk of complications, such as granulation tissue on nearby structures, tracheal stenosis, and erosion of the innominate artery or fistula formation. In planning tracheostomy care, consider the following questions. What signs and symptoms indicate the need for tracheostomy care? When was tracheostomy care last performed? What type of tracheostomy does the patient have? How long has the patient had the tracheostomy? What factors affect the functioning of the patient's airway? Can this procedure be delegated to assistive personnel?
And use one to cleanse the top aspect of the trach tube and one to clean the bottom aspect.
You will provide tracheostomy care when the patient has a new tracheostomy, although the procedure can be delegated when the patient has an established tracheostomy. Be sure the care provider understands the proper technique for each patient, potential complications, and any observations to report to you immediately. Mr. Gonzalez is on contact precautions, and his nurse wears clean gloves during each care procedure. Here, she applies a sterile glove over the clean glove on her dominant hand to perform tracheostomy care.
Resistance, I hit the carina.
Suction the tracheostomy, then carefully remove the soiled dressing around the tracheostomy tube. Discard the dressing, suction catheter, and gloves in the appropriate receptacle. Prepare your other supplies on the bedside table.
And Jenny, I got these cute long Q-tips, and I have my Safe Cleanse, and I'm going to get them moist. And as I start, Mr. Gonzalez, can you turn your head towards me, please? Thank you. So we're going to insert at the top, get down to the tube, and roll it as I drag it across the top of the trach. With the second one, I'm going to go along the lower aspect of the trach, up underneath the flange, to the tube, and roll the tip all the way to the other side. And it looks really good. There's no redness, just that scant amount of green drainage that was there, no swelling. Okay, now we're going to change your inner cannula, and you have an 8 disposable inner cannula Portex. And this is a sterile procedure, Jenny, so what we want to do, you hold that for me, thank you. He can breathe when I take this out. What the inner cannula does, it helps to minimize occlusion of the trach. Okay? And I know it makes you cough. I'm sorry, Mr. Gonzalez. And you see that it's curved and it's sterile. Now this is going to go inside of his trach, and I don't want to contaminate the part that's going to go inside. The tip here has a little soda top tab ring that you can hold on to, and that's the part that I want to hold on to. And you can see that it's curved to fit the curve of the trachea. And when you insert it, you're going to have to follow that curve. So it's not like you want to force it. And you want to be careful not to push too hard into his trachea, because it'll make him gag and cough, and it'll be like me pushing on your throat. So I'm going to pick this up, and then I'm going to insert it. And what I'm going to do is I'm going to stabilize his trach by holding on to the exterior flange and insert this here. And sometimes you have to manipulate it just a little bit and slide it in, and then it clicks into place. And we're done. The next thing I'm going to do is put the new drain sponge up underneath of there. And we do this 3 times a day to make sure that we don't get any cellulitis or infection or ulceration to develop at the trach site. And it's not a sterile procedure. So we lay the drain sponge like so. We'll be able to tolerate without this trach collar for just a moment and be able to see better, so you can see better how I do this. Okay, we'll just place the trach collar, maybe angle it in a position where he can still get some of the humidity and oxygen. If you can take the tip, the inner tip, and kind of dog ear it like this. And Mr. Gonzalez, can you turn your head to your left, please? Thank you. And make sure you get all the tubings out of the way. The trach ties should not be too tight, but you want to be able to fit a finger beneath there. I'm sorry, Mr. Gonzalez. And just slowly edge that up, and when you get it up there, it allows that tip to flip up, and you want to make sure that you keep it flat so you don't cause any further skin damage. And the same thing you want to do, you want to take this inner corner and dog ear it and slide it up underneath the trach flange to allow me to grab something, have something to grab hold of. And like that. See how that flipped up like that with that dog ear? It makes it a lot easier to have something to hold on to. Okay, now that I've got that flipped up, and see how that now I can snugly tighten it up to where you want it to fit underneath the flange. Because what tends to happen is this flange is kind of hard, and it can has tendency right here to dig in and cause an ulcer. It's very painful. So we want to try to prevent that from happening. Okay, we're ready to do your, change your trach ties. So, Mr. Gonzalez, I'm going to reach behind your neck.
The ties that keep the tracheostomy tube in place become soiled. Always have someone stabilize the tracheostomy tube as you apply new ties.
Now that you're holding onto that trach, what I'm going to do is this little hole that's on the side of the flange right here, I'm going to pull this all the way tight and lay it down flat onto that, and we'll do the adjustments with this side. Okay? So I'm going to do the Velcro here. You doing okay, Mr. Gonzalez? Okay. Let's see. And it's a little too loose. Let me see if I can tighten this any further.
When tightening ties, be sure you can slip a finger between the tie and the patient's neck.
And let's snap that back down for his trach collar. Do you need suction, Mr. Gonzalez?
Document the procedure and note any signs of infection or skin breakdown in the patient's record and nurse's notes. Providing supplemental oxygen therapy is an important nursing responsibility. Skill in initiating therapy is essential, but equally important is your ongoing assessment, which enables therapy to be adjusted to your patient's needs in a timely manner for optimal therapeutic benefits.